Hi, we're your Houston chiropractors, and I'm Dr. Gregory Johnson, and this is
Dr. Tristan Went.
And we're here at Advanced Chiropractic Relief in Houston, Texas, and we're doing something a little different today because we're going to share with you a brand new scientific published study by Dr. Heidi Haavik, Imran Khan Niazi out of New Zealand Chiropractic College and their research team of physiologists, PhDs, chiropractors, MDs. They've got AI people working on this stuff now, and
Radiology specialists, all kinds of people.
yeah. But this study that we're going to cover today has practical applications for you as a patient, as well as doctors who are watching this too.
I think one of the biggest questions that a lot of patients would ask first is, when was this study even done? How old is this research?
Well, this was actually published in Brain Sciences in November of 24, so that's really recent.
Yes, sir.
In the past 6 months.
Absolutely.
And I actually just returned from Las Vegas, Nevada, out there at Parker Seminars, and actually got to hear Dr. Heidi Haavik present this to the entire class of people that went out there and listened to her.
That's awesome.
She presented this paper, and when she was done presenting this paper in detail, she got a standing ovation
Awesome.
at the end of it from all the chiropractors, and there's chiropractors worldwide there.
What was kind of her synopsis or her gist of what the study was about?
You know, the gist of the whole study is that, and just look at the title here. It is entitled Neuroplastic Response, get my old man with specs on here, to chiropractic care, broad impacts on pain, mood, sleep, and quality of life. And, you know, this is in PubMed, which is the place to find the most significant scientific articles on anything, really.
Yes, sir.
National Institute of Health and PubMed, which is all the index literature. The gist of this whole thing is something that we've actually been practicing in this office on a daily basis with our patients, is that when you find dysfunctional vertebral segments, which we call motor units, and dysfunctional motor segments or motor units is the spine is a kinetic chain of 24 freely movable vertebrae. Now that's important, just freely movable vertebrae, because if a vertebrae, or vertebrae, plural is vertebrae, vertebra subluxates, and above and below that has to compensate for it, so you get a entire motor unit dysfunction, which we call subluxation. And the gist of this is when you adjust the subluxations of the spine, which are those dysfunctional motor units, you create a afferent neurological event that fires through the spinal cord up into the brain, affecting the cerebellum, the prefrontal cortex, the motor cortex, and the brain then wakes up and communicates then efferently, which is coming down from the brain to the body, proper messaging regarding stability and what we call homeostasis, which is balance of the sympathetics and the parasympathetic nervous system. Most people we find in here practically are hypersympathetic. That means they've been in fight or flight and stress levels. In fact, they talk about stress as being the number one cause of subluxations.
One of my next questions are what some of the
Physical
things that
trauma, stress, emotional trauma, stress. Abuse is a biggie, like, you know, somebody getting verbally or sexually abused when they're younger, or physically abused.
And one of the big things too about the study and how they read the neurological changes pre and post adjustment is using EEGs.
Sophisticated neurological measuring devices, EEGs.
And we'll leave a link down below to go look at all the charts and everything in there, because we won't dive into the specific EEGs and everything.
Yeah, that's way
here.
too technical to
but
talk about.
But we can leave a link to the 33-page study.
But
with
it's
all the resources.
neuroscience. It's all brain stuff. That's why it's published in Brain Sciences, which is a huge deal, really.
Absolutely.
Because that's neurosurgeons, neurologists, neurophysiologists.
They looked at quality of life with some different objective
Yes.
measurements with the PROMIS B29, I believe it was.
Yeah, and that's why they talk about mood. I mean, this affects anxiety, depression, sleep, just overall quality of life, feeling like you want to live your life again.
Because there were significant changes in the categories of sleep as well in the
Yes.
chiropractic group versus the control group.
That's right. This is a double-blind study.
How frequently were the patients getting adjusted in the study?
In this study, they were getting adjusted 3 times a week for 4 weeks.
4 weeks.
And they measured them after the very first one, and then week by week, and then at the end of the 4 weeks. So they saw the cumulative results of it in the control group and the actively chiropractic participants.
And they used a Fitbit to track different sleep qualities, heart
Right.
rate, that kind of stuff.
Right,
blood pressure,
correct.
all those different physiological
Right,
functions.
and
as well.
SSCPs, which are pretty sophisticated, somatosensory evoked potentials.
So,
You know, these are things that I taught Tristan, gosh, way back in 10 years ago,
10 plus
before he
now.
even started going to Palmer. We were talking about bombarding the brain with afferent neurology, and she specifically states that on page 4 of 31. Chiropractic participants included manual high velocity, low amplitude adjustments to the spine and or pelvis, ipsius pubis, sacroiliac joints, sacrococcygeal joints, all the things that we adjust in here as being identified as subluxated, dysfunctional. They're not moving properly with each other. And when that happens, that cuts off that afferent input into the brain. So the brain just kind of goes to sleep and forgets about that part of the body
it's
again.
that disconnect.
And it creates the disconnect that you get. So when your brain's not connecting with your body, you can't be in a state of health because it's not getting that feedback information that it needs to remain in homeostasis. Then it goes on to say, and this is the part that really I like, the high velocity, low amplitude directed at vertebral subluxations rapidly stress the paraspinal soft tissues, in particular the deep, small paraspinal muscles, which are the ones that have the most proprioceptive afferent fibers in them through the mechanoreceptors, results in a bombardment of proprioceptive input to the central nervous system, eliciting changes in central neuroplasticity, excitability, motor control changes. These are quotes right out of the study here I'm reading off of. These sites selected for spinal adjustments were based on the chiropractor's experience and included clinical indicators of vertebral subluxation such as tenderness to palpation, which we do on all of our examinations. Manual palpation for restricted intersegmental motion, which is motion palpation really. You're just moving the spine and seeing where it's restricted. And then those sites for spinal adjustments based on also the chiropractor's experience. Moving those joints, putting the range of motion, the normal joint range of motion back into the joints, which when you do that, you have to go through the full joint range of motion to the anatomical integrity of the ligaments, which is where the mechanoreceptors are stimulated in the synovial joints. And the reason that we adjust every joint is because not only do we want to have the spine and pelvis afferents going into the brain, but we want all the extremity joints that we adjust, including the fingers and
Part of the
feet.
bombardment.
That's part of that bombardment. And that's really what Johnson BioPhysics is based on.
So how can a patient use information like this on determining if they should see a chiropractor or come get their ring dinger?
Yeah, that's a great question because people really, a lot of times they feel like they need something done, but they don't quite know exactly what to do.
Can't quite put the
But the major things that they talk about in this study is patients feel a sense of stiffness and soreness in certain areas of their body or joints. And that soreness and that stiffness is what creates the abnormal, maladaptive afferents that go into the brain that messes up the brain's efferent messaging back to the body. So people maladapt and they actually adapt to those abnormal biomechanical movements in the spine. So they get that brain disconnect right there. That's the major thing that this study shows for patients. So if you think about this, as a patient, or anybody for that matter, listening, doctors or patients, when you feel stiffness and soreness in any of the joints of your body, that can create these abnormal afferent messages into the cerebellum and the cerebral cortex and the motor cortex that cause the disconnect in the brain to send back out efferent information that helps balance the neurology, balance the movements, and also readapt to normal motion, because they actually have to readapt to the normal range of motion as opposed to what they've already maladapted to, which is the abnormal range of motion or dysfunction.
Like you always said, you can't super glue them in place, so it's
That's
about
right.
the frequency and the brain changes that you're making over time, which is why the adjustments were 3 times over a 4-week period.
Yeah. Now we only see our patients like 3 days, and then we cut them off and they go home and just look in the mirror at their posture, because posture is a mirror of your spinal biomechanics. But also they can feel in their bodies if they're getting stiff and sore, and those are the prime indicators that you need to be adjusted. So,
and one of the biggest messages too that we try to get out there is being proactive instead
Yes.
of reactive. So not necessarily waiting until it's painful or excruciating and you're having to crawl into the office. We love helping those kinds of patients, but really being proactive and coming in when it's just the stiffness or just the soreness before you're in those
that's another
full-blown-
big point of this study. Actually, it talked about you don't even have to have pain to have this kind of dysfunction that disconnects your brain from the body.
Yes, sir.
It can just be those abnormal functional motor units that got stuck, and therefore you're not getting all that
almost on a subconscious
afferent
level
information in
until-
there. So it
Pain
creates dysfunction, and part of that dysfunction is perceived by the brain as pain in some cases, but also other cases not. So you might just have brain fog or
That's a big thing that we,
decreased mental capacity.
a lot of patients after getting adjusted say they feel like they can breathe better,
Oh, yeah.
think clearer.
Yeah,
a lot of
all of
different
the above. In
things.
fact, that's the reason I get adjusted once or twice a week from you,
Amen.
is just keep my brain at its top level of function at all
Because
times.
it's not that we're in pain, but we know that we
Right,
function.
exactly. I mean, I'm not really in pain. I get stiff and sore from laying wrong at night or
Or
something.
working on patients.
Yeah, working on patients. But we practice what we preach here, and I teach these same principles to our team reindeer doctors who come in here and learn our techniques. And it's just really an important study for patients as well as doctors to know that our job as chiropractors are to find dysfunctional motor units or subluxations in the spine and pelvis or extremities, adjust those, fire the afferent proprioceptive neurological information that goes into the brain from those dysfunctional joints, so that the brain can get back on track of communicating back with the body efferently
Homeostasis.
and create a higher state of health, which is homeostasis.
Where could a patient or even docs find this kind of information, or if they
Yeah.
wanted to research more or look into this study specifically?
Well, this study is published in PubMed, Google Scholar, but PubMed is the main source. This particular one was published in Brain Sciences, which is a whole, like all brain stuff. Yeah, neurosurgeons, neurologists, neurophysiologists, which is Dr. Heidi Haavik and Imran are both PhDs. She's a neurophysiologist PhD, I think his is.
And we can leave a link to the specific study as well if you
Yeah,
want to click on
I'll
it,
leave a
look
link
into
to
the
this
charts or
study in
tables.
Brain Sciences, and I'll also leave one for PubMed so you can see that's published in the most respected areas of where eating published
Well
research
quoted,
is.
yeah.
Yeah. Oh yeah, there's like
Thanks,
8
Jesus.
pages
Yeah.
worth of
resources and
resources and references that they reference in these studies. I mean, very, very sophisticated stuff. I mean, I could go into the measurement tools, but it's just too much. I will read the conclusions to you though. This study evaluated the underlying neurophysiological mechanisms of chiropractic care using a multifaceted approach, recording behavioral, subjective, and neurophysiological data. The behavioral data recorded through a Fitbit revealed significant improvement in light sleep stage length in the chiropractic care group throughout the entire 4 weeks of intervention. There was also significant increase in the quality of life measurements among the chiropractic participants as compared to the control group. Yep. As well as decreases in pain intensity and pain interferences, but it affected anxiety, depression, fatigue. How many of you out there feel anxiety or fatigue or depression? I mean, people are taking pills for anxiety and depression. And this sheds light on, if you just get adjusted, you don't have to take those harmful, dangerous drugs and medications or have more invasive medical care. for those things, because chiropractic can address those things through the adjustments of the subluxations, which is really the basic core tenets of chiropractic. When I went to Palmer in 1981, well, I graduated in 81. I went there.
Plus, it's a little scary listening to some of the side effects from some of that pharmacology intervention that they'll use.
Yeah, there's a lot more of those than there are good effects, actually.
Absolutely.
These subjective and behavioral improvements were recorded alongside neurophysiological findings obtained through EEG, spectral and source level analysis. Chiropractic adjustments most likely act as a salient signal that is to activate the salience network in the central nervous system, which is the brain and spinal cord. And the CNS focuses attention on the vertebral column segments sensory inputs. So where you stimulated those dysfunctional motor units, the brain just keys back into those now and recognizes that whole different normal movement pattern. And this needs to be explored in future analysis. I mean, they're going to have years and years of research that just can branch off of this, even into she's got a big study planned in the clinical relevance of these long term too. She's just a world-class researcher, and she's probably the most highly respected researcher of our time.
Absolutely.
In chiropractic and the brain stuff.
Neurophysiology.
And Dr. Kelly Holt down there in New Zealand, he's the president of New Zealand Chiropractic College. He's also involved with the research too.
Really, a big thing too is her ability to relate that information to docs and to patients, and kind of teach the relevance.
She explains it a whole lot better than I am right now, but
that's where you can look up Heidi Haavik and look at some of her talks, or even look at her website.
Yeah, I'll leave some links to New Zealand Chiropractic College website that you can look at their research stuff, and also to her learning platforms, KairosAcademy.com and KairosHub.com.
And if you have any specific questions, try to leave those down in the comments, and we won't necessarily comment back at you, but if it's something that we think could be answered and provide some more information for docs or patients out there, we can make another video answering some of those questions.
That's right. But I think the most significant message I want to get out to the public right now is, when you're feeling stiff and sore and disconnected, or you have anxiety, depression, stress levels high, and you just feel stiff and sore and yucky, that's the time to get checked for vertebral subluxations and
get ahead of it.
And chiropractors who detect and then adjust those subluxated dysfunctional motor units of the spine, they actually are really doing something high level for that patient's health care, and that is reconnecting their brain back with their body again so that they can function at a higher level of health naturally without drugs or surgery.
The way the good Lord intended it.
That's right. You know, Trisha and I practice those same principles in here every single day. We put Dr. Haavik's research into practice here in this office, and in fact, this entire technique is really based on the research that she's published.
And we'll be here in Houston ready to give you your first
Yeah,
or whenever you're ready for it.
We are accepting really difficult cases too. I mean, those are fun for us actually, to see the really hard cases. Herniated disc, spinal canal stenosis, foot drop, cauda equina stuff that has been chronic that nobody else is touching. We're not afraid to adjust those areas because they're not going to get any worse with that.
Plus, we trust ourselves and know the histories and
Well,
exams.
plus, if we
do
need to, we
beforehand.
refer for a neurosurgical consult when necessary. And
most patients coming in with those issues already, they have tons
they've
of
already been to the
radiology reports
neurosurgeon.
and, tons of other things for us to look through and already.
And a lot of times, we're last resort for those people before they get on the table and get the knife.
Yes, sir.
And they've already been on drugs, and drugs aren't fixing anything. They're just hiding symptoms. ESI is epidural steroid injections. It's a very invasive medical procedure where they inject steroids directly into the canal itself, which are the three layers of protection that's over the spinal cord, that they just bathe those neurological components in the cord. Yeah, the three meninges. And there's dura mater, pia mater, and what's the other one?
I said those two. You get the third one.
Arachnoid space.
Yes, sir.
Yeah, the arachnoid, which is where the cerebral spinal fluid flows through.
Yes, sir.
That's right.
Yes, sir.
So, if you feel stiff and sore and discombobulated, you got brain fog, you just don't feel connected like you used to, you can't walk as good as you used to, you can't talk as good as you used to, you can't think clearly. Those are all signs to get checked and adjusted. And for the patients that we see here too, we're making a little bit more of an adjustment to our recommendations on treatment, because we would let patients go off and just go a year or two without adjustments, when really that's not in the best interest of that patient's health. So, we are now teaching our patients, when you start feeling stiff and sore and achy and disconnected, look in the mirror at your posture. When you feel those things, that's time to come back in for an adjustment tune-up, so that we can keep you in that good state of health that you're already enjoying after those first 3 days of treatment here.
Now we're gonna get back to square one.
Yeah, that's right. You don't want to
That's a
just
part
be
of it.
chasing the symptoms all the time, because
That's part of the proactive versus reactive
that's
conversation.
right, that's right. And then that's when patients turn to drugs and injections and
So,
more invasive procedures that really don't fix what we're talking about here. We're talking about getting really down to the underlying cause, which is brain dysfunction, and neuroplasticity, which is the adaptive capability of your brain innately to adapt to its environment, both internally and externally. And that's happening 24/7, whether you realize it or not.
So if you're ready to be proactive and get your first ring dinger adjustment, make sure you check us out on the website or reach
And
out to Ms.
get
Marie.
healthy again. Start living your life. That's what we're all about here at Advanced Chiropractic Relief.
We look forward to helping you and serving you and your spine.
Yeah, and there'll be a link in the description box of this for our website that you can request an appointment to see us. But we'll also have links in this description box also to Dr. Haavik's and Imran Khan Niazi's studies and their research team out in New Zealand that you can look up in PubMed and Brain Sciences. And this is really about just getting you healthy again, and how we're going to be a big part of that solution for you. If you have subluxations, we'll accept you as a patient. We'll adjust those subluxated areas of your spine and pelvis and extremities, and we'll get your brain talking to your body again. And that's what it's really all about.
Yes, sir.
Boils down all this too. That's right. Well, this is your Houston chiropractor, Dr. Gregory Johnson, and this is
Also your Houston chiropractor, Dr. Tristan Wynn.
coming to you from Advanced Chiropractic Relief in Houston, Texas, where we take science and put it into daily clinical application.
Amen.
We'll see y'all soon for your ring dinger.